Yeah, you were saying, yeah, okay.
Hello, Gabriel?
Yes, Gabriela, but it's fine.
I'm your doctor and I'm here to tell you what's wrong with you. You are 35 weeks gestation and the fetus is in utero and is in great distress, and you are at risk for intrauterine fetal demise. My helpers ran tests and these are the results. We've recorded you have multiple episodes of hypertension, having a systolic blood pressure of 140 over a diastolic blood pressure of 90 several times since you've hit 20 weeks gestation. You've reported increased cranial pressure, facial edema and epigastric of right or upper quadrant abdominal pain. I've noticed clonus and altered mental status. My technician drew blood from your left extremity, and the CBC blood cultures serum alanine amniotransferase or aspirate amniotransferase levels, serum creatine, peripheral blood smears, serum lactase dehydrogenase level, and indirect bilirubin showed impaired hepatic function and elevated liver enzymes. There was also the urine culture that they obtained from intravenous straight cath, and it showed that you had proteinuria of greater than 0.3 grams, right?
Uh-huh.
And then I expect your vision to become blurry soon, seizures and fetal distress. We'll get some follow-up labs, and I'll be back shortly to handle this. Hang tight.
Okay. What was that? I didn't understand anything. Clonus? What is that? Oh my gosh, what is wrong with my baby?
Hey Gabby, what is health literacy?
Health literacy is how well a person understands medical terms and how to take care of themselves.
Christina, how can we assess health literacy?
There are health literacy measurement tools that can be used. Communicate clearly. Confirm understanding by using the teach-back method. Get creative with your ideas. And always be sure to ask questions.
Christina, what is the impact of low health literacy?
If a patient has low health literacy, it can affect their discharge instructions, understanding of treatment, and signing consent forms that they quite don't understand. In this situation, Gabby and her sister did not quite understand what the doctor was saying. This made for a very stressful environment.
Heidi, what are good resources for patients?
We want to use videos, brochures or pamphlets, and websites. Websites should end in edu, .gov, and .org.
Heidi, how will your approach change if their health literacy is low, moderate, or high?
Based on patients' understanding, we must modify our language in order to make sure the patient fully grasps what is being communicated to them. Someone with low level of health literacy may not understand certain words or the full extent of their diagnosis compared with someone with high level of health literacy, and it's our job to make sure they do. An approach may be to use words that patient may understand based on their level of understanding, explain in detail what they are trying to convey, ask the patient if they understood what was said to them, encourage them to ask questions, and maybe even use diagrams.
Victoria, how can we relate a nursing code of ethics to health literacy?
So, we know that Provision 3 states the nurse promotes and advocates for and protects the rights, health, and safety of the patient. So, we as nurses are the advocates for our clients. We are to make sure they are receiving the best care possible, and that includes making sure they understand what is going on. We should make sure our patients know that we are here for them and available to answer any questions they may have, and if the questions are out of our scope of practice, then we'll find the right person to answer it. I personally would be terrified if I was about to be poked or prodded without understanding what was happening. We must vouch for our patients and get them the information they need and deserve.
Yes.
Hi, good morning. How are you?
Good, thank you.
And you are?
Gabriela Umada.
Nice to meet you, Gabriela.
Nice to meet you.
Hi, and you are?
I'm Heidi.
Heidi, and who is this in
That's my
relation to?
sister.
Your sister? Oh, okay. Well, I'm Nurse Christina. I am your nurse today, okay? I have a few questions to ask.
Okay.
First off, and your name one more time for me,
Gabriela Umada,
and your date of birth?
March 24, 95.
Okay. Sounds good. I see that both seem a little distressed.
Yes.
Yeah. Is it okay that your sister's here and that we
Yes,
discuss?
she can stay.
Yeah. Okay. I just have a couple questions for you.
Okay.
Is English your first language?
No.
No?
Spanish is my first language.
Okay. And are you okay to read English? Are you feel comfortable?
Yeah, but my sister always helped me.
Okay. And are you comfortable filling out your own paperwork? You said your sister helped,
Yeah,
you
she's
helped her
there.
with that? Okay. And do you have any other questions for me?
Yes, actually, the doctor came early
Mhm.
and he explained a bunch of stuff. And to be honest, we did not understand.
She just left us more
Yeah,
confused
and
than
I'm
what we wanted.
Okay. Oh, I'm sorry to hear that. All right. So I know the doctor said a lot of words that sounded confusing, but let me explain some to you, okay?
Thank you. We appreciate
Yeah, of
that.
course. She was telling you the symptoms you talked about, like stomach pains, headaches, your face being slightly swollen, which makes the doctor think that maybe you have preeclampsia. The way to solve this is to deliver your baby. Preeclampsia is when you have high blood pressure, and it's because the way your baby is growing inside you and pressing against your blood vessels.
And my baby's so little.
Well, we're waiting on the rest of your lab results from the blood we drew earlier to make that decision.
Okay.
Okay. You will need some medication to develop the baby's lungs, to mature the lungs first before we deliver. Your baby should be able to survive during the delivery. So it being so small, it should be okay.
Okay.
And right now we are just concerned about your health because we want to avoid your vision going blurry or having any seizures, okay? So we'll give medication for that as well,
Okay.
okay? So while we wait for the rest of your results and for the order from the doctor to get your medication, is there anything else that I can answer for you or get for you to make you more comfortable while you wait?
No, you've actually been so great to us.
We-
Thank you.
Yeah,
able
my
to fully
pleasure,
understand
anytime.
everything.
You have your bed light, I believe, on the other side
Yes,
there.
yes.
So
Uh-huh.
go ahead and feel free to push it and I can come in and whatever else you need, okay?
Thank you
Yes,
so much.
my pleasure. I'll see you
Thank
soon,
you.
okay?
Thank you.
All right.
Later, the doctor returned and apologized to Gabriella and her sister for her rude and disrespectful behavior. She also provided 2 articles and 3 resources for the patient to use to learn more about preeclampsia.